And my first guest joins me in studio is Dr. William Thompson IV. He is a specialist in infectious diseases, HIV, and travel medicine. He's also a member of the Orange County Medical Association. Dr. Bill, good to see you again.
Good to see you. Thanks.
Okay, so I think you've been spending a little bit of time these last few days talking about swine flu.
Every day in committee at the hospital, patients. It's been a busy week.
What I wanted to do here on this program is kind of get back to the basics. Let's first, if you could tell us exactly what is swine flu in general.
All right, swine flu is an influenza A. We're not calling it that now. You know, information's evolving. It seems daily. It seems to be a combination of human, swine, and bird flu that's kind of combined genetically to become this H1N1 virus that's an influenza A. And it's starting to spread, and it's spread to 20 countries. It's in 38 states, and it's raised concern and some panic.
Are we facing a pandemic?
Well, yeah. I mean, it's the definition of pandemic is, you know, sustained human-to-human transmission in multiple countries. It may end up getting to that level 6 that the World Health Organization talks about, but the fact is that it's a mild virus. And it's not as dangerous as the regular flu that we had just this past season.
Well, I'm glad you brought up regular flu. I don't have another word for it. We'll just refer to it as regular flu. But actually, many people die from regular flu on a weekly basis, correct?
Absolutely. Thousands of people did this past flu season. Nobody talked about it like this. We've only had one patient die from this virus, and we've had 80 confirmed cases, or 280 confirmed cases. Not a big deal so far.
Now, when I first heard the story about swine flu breaking, it kind of brought me back to 1976 and the debacle of the Ford administration, the swine flu mass inoculation program. People were becoming paralyzed from the inoculations. All kinds of problems happened. Fortunately, I never actually did get the inoculation. But is there any comparison to the swine flu of 32 years ago and what we're seeing now?
Well, there is some comparison, and it's more historical. There was one soldier at Fort Dix that actually died. He was the index case that died. Then they found out that the 500 soldiers had been infected. So they looked at this attack rate, this high attack rate of the virus, and that's what these epidemiologists look at. And they thought, well, wow, if it attacked 500 people, it's going to attack the rest of the nation. You know, the public health departments really went into action. And the president and his Health and Human Services secretary created this mass inoculation program. Unfortunately, it was a disaster, and more people got sick and even died from these inoculations. And after 40 million people were inoculated, they stopped it. It was an unbelievable disaster, and people lost faith in the public health departments.
Well, fast forward to today, and we've seen just all kinds of crazy things going on. I mean, the government of China quarantined a bunch of Mexican tourists because one of them tested positive for the virus. In Mexico itself, they were closing churches and clubs and restaurants, anywhere where people met publicly. I myself, I remember just a few days ago, I was in church at a church in Orange County, California, and the priest was telling us, okay, at the certain points of the Mass where we're supposed to touch hands or shake hands, just nod to one another. I mean, there's been this mass hysteria that's been going on, people wearing surgical masks onto airplanes. The vice president said, don't even get on an airplane, which, you know, ticked off the airlines. I mean, have you ever seen anything like this in your career?
I haven't, and I'm watching this panic unfold, and I watch TV, and I think, gosh, if I was an infectious disease specialist, I'd really start to get worried. And it's a frustrating thing, for sure. And, you know, you see the patients calling up, you know, taking up time on the phone, taking up space in the emergency room. We had a patient at the ER the other day, came back 3 times because he was convinced he had the flu and didn't pass the test each time.
Amazing. I mean, and then, of course, there were reports that it wasn't safe to eat pork products. I mean, people stopped buying it in the stores. You couldn't get anybody to buy a BLT.
Yeah, the rumors just took flame. It was just terrible. And, you know, the rules are the same for any infectious disease, and we repeat these every single flu season. You know, number one, have good respiratory etiquette. Don't cough in people's faces. If you're on the elevator, try not to cough. If you have to, you know, lift up your shirt sleeve, you know, cough into your elbow, that type of thing. Don't touch people if you've just coughed on yourself. Wash your hands frequently. You don't need to become obsessive compulsive about it, but, you know, have proper respiratory etiquette. You know, you can stay away from crowds if you know, if you're worried about that. And the other thing is, if you're sick, stay at home. Don't go to work. Nobody needs you at work that badly, because you're just going to make more people sick.
Now, this first wave, so to speak, seems to be ebbing, but the World Health Organization did indicate that a second wave could be perhaps even more dangerous and more of a concern. I mean, how do you feel about that?
Well, these are things that, you know, I almost wish they wouldn't talk to the public about. You know, they talked about, oh, it might go dormant for a couple years and then come back as the 1918 virus. We shouldn't talk about that. We need to speak responsibly, speak logically, and speak calmly. And education and knowledge is power. That goes for everything in life, but especially with infectious diseases.
I'm so glad you brought up the 1918 virus, which has been used as a comparison of this. I mean, you know, hundreds of thousands of people died during that. And let's face it, I mean, medical technology, medical availability was not anywhere close to what it is today. I mean, that could never happen, at least I would think.
Yeah. And yeah, I know what you're saying. It was completely blown out of proportion, and then it seems that this 1918 virus is always in the back of everybody's mind. So they worry, the public health people are really trying to do a good service for people. They really are. It's just that they worry that something like this 1918 virus could be released again. And
well, you know, media mass hysteria. I mean, the current recession is the new Great Depression. The current swine flu virus is the new 1918 virus. Does this guy look frustrated? He probably is.
And the politicians, of course, want to make it look like they're doing something for the constituents, and so they respond to the news media.
Dr. William Thompson IV, he's with the Orange County Medical Association. Dr. Bill, thanks so much for straightening this out for us.
Oh, you're welcome. Thanks for having me.